Hello, my students. In this chapter, you are going to study opioid analgesics. The relief of pain by using opioid analgesics is an ancient pharmacotherapy still very much in use today. Before I introduce the drugs, I also help you to review the background knowledge of pain. Pain is an unpleasant sensory and emotional experience felt as a result of brain's response to damage, disease, or injury. Pain is a specific sensation independent of touch or other sensation, having a specific central connections. It is a kind of protective mechanism and serves to alert an individual to actual or potential tissue damage. This damage can be caused by exposure to noxious chemical, mechanical, or thermal stimuli, or by the presence of some disease. And this damage can activate nociceptors on sensory neurons. So pain is a common symptom of many diseases. For the patients who have pain, when they go to see the doctors, they are usually asked to describe their pain in terms of intensity, duration, and location. In some cases, patients may report their pain by intense, sharp, or stinging. In the other cases, the patients may describe a dull, burning, or aching pain. Pain can be further distinguished on the basis of whether it is somatic, visceral, or neuropathic in origin. Somatic pain. It can be located clearly in specific dermal, subcutaneous, or musculoskeletal tissue. But visceral pain, it is poorly located, localized, and may be referred to thoracic or abdominal structures. And neuropathic pain is usually caused by nerve damage. To relieve the pain, usually we use these drugs. These drugs caused by analgesics. Analgesics are broadly divided into two families. Analgesics acting on CNS, analgesics, antipyretics, and anti-inflammatory agents. In this chapter, you study analgesic acting on CNS. These are drugs acting on opioid receptor to relieve pain and unpleasant emotion caused by pain. This opioid receptor agonist can relieve pain without affecting on consciousness and other sensations. So their mechanism is related to opioid receptor activation. So that's why they are also caused by opioid analgesics. And most agents can induce addiction. So they're also caused by addicted analgesics. And they can decrease the dose of anesthetics. And they also have a sedation on the CNS. So they're also named narcotic analgesics. Opioid agonists produce analgesia by binding to specific G-protein coupled receptors. Opioid receptors. These receptors located primarily in brain and spinal cord regions involved in transmission and modulation of pain. The major effects of opioids are mediated by three receptor families. They are mu receptor, DIRT, and kappa receptors. Each receptor family exhibits a different specificity for the drug it binds. All three opioid receptors are members of G-protein coupled receptor family. And these receptors are also associated with ion channels by increasing postsynaptic calcium efflux or reducing presynaptic calcium influx. Finally, they have inhibitory effect on the neurons. The different type of opioid receptors, they are related to the different pharmacological effects of opioid analgesics. Mu-type receptor, it is associated with analgesia, euphorant, respiratory depressant, physical dependence properties of the typical opioid receptor agonist, like morphine. And the kappa receptors control spinal analgesia, sedation, and miosis. And the kappa receptors is also related to analgesic effects. Actually, in our body, we also have some endogenous opioid peptides. Three distinct families of peptides have been identified in the brain. They are enkephalins, endorphins, epinephrines. These endogenous opioids are capable of binding to opioid receptors in the CNS, producing analgesic effects. Look at how they work. At the molecular level, opioid receptors are linked to G-proteins and therefore are capable to affecting intracellular calcium disposition and protein phosphorylation. The two opioids have two well-established direct actions on neurons. Look at this nerve ending has some domain to bind by endogenous opioid ligands. After binding by these, like enkephalins, they will reduce excitatory transmitter release by decrease the calcium influx. They also can inhibit postsynaptic neurons by opening potassium channels, decrease the potassium ions permeability, so decrease the excitability of the neurons. So, all in all, opioid receptors are present on both spinal cord pain's transmission neurons and on the primary efferents that relay the pain message to them. So the opioids analgesics, they usually act on the central nervous system, including dorsal tone. And opioid analgesics relieve the pain by mimicking the function of the endogenous opioid peptides, which activate the opioid receptors. Look at the classification of opioid drugs. These drugs can be classified as a full agonist. This group include morphine, pethidine, codeine, methadone, fentanyl, dihydroentropine, and some opioid receptor pathway agonists. In some textbook, this also is named mixed agonist-antagonist. I think you can still remember what's the meaning of partial agonist, So some textbook also named it mixed agonist-antagonist. There are many agents are partial agonists. In this chapter, you also will study antagonists of opioid receptor, naloxone and naltrexone. From this slide, I think you can understand. At least, you should know these drug names in colorful highlighted color. Yeah, there are so many agents' names. It's so difficult to remember every one of them. So at least you should know about these drug names, especially morphine, pethidine, and naloxone. In this chapter, morphine it is the representative drug of opioid receptor agonist. So you will study this drug in detail. So what are the pharmacological effects of morphine? Let's go and study. Morphine is the prototypical opioid agonist. It often used to relieve severe pain with remarkable efficacy. Morphine named after Morpheus. This name is the Greek god of dreams. It is related to the pharmacological effects of morphine. Later, I will introduce the effect in detail. And opium poppy is the source of crude opium from which Stirner isolated the pure alkaloids. This plant is one of poppy. After the petals of a flower have dropped, this is the seed pod of poppy. Make an incision on the seed pod. Then the white latex ooze out, and then turns into thick brown gum. This is raw opium. This opium contains many alkaloids, about 20 kinds of alkaloids, including morphine, codeine, nicotine, etc. Morphine is the principal alkaloid in the opium. It accounts for about 10%. And from these alkaloids, it also can distill heroin. I think you know this agent. It induces opioid addiction and often related to drug abuse. In the natural world, there are many kinds of poppies with beautiful flowers. But because poppy contain alkaloids that lead to opioid addiction, cultivation of opium poppy is now restricted by international agreement. But enforcement is so difficult, and illicit production of opium is widespread. As one ornamental plant, opiums are so popular that many people like to cultivate them. And of course, it also widespread of cultivation is also related to the pharmaceutical uses of opium. I have added some pictures of poppies to this slide in this chapter. I hope you like them as much as I do. The mechanism of action of opioid analgesics, it is because of activation of opioid receptors. In activating steroids specifically with opioid receptors, these drugs can decrease the release of substance P and inhibit the release of many excitatory transmitters from nerve terminal, carrying nociceptive painful stimuli. Substance P, it can modulate pain perception in the spinal cord. So, opioid analgesics has analgesic effect. In this chapter, the pharmacological effects and therapeutic clinical uses, adverse effects of opioid analgesics, especially full agonists like morphine, these contents are more important for you. And other opioid agonists, individual agents, their characteristics, you also need to understand. Morphine, it is the representative drug of opioid analgesics. It is one full agonist. It has many pharmacological effects by activation of opioid receptors. Many effects are on CNS, and it also induces some peripheral effects in the smooth muscle or CVIs. Now, let's study one by one. As one representative analgesics, the first effect of morphine, it is analgesia. Pain consists of sensory and emotional components. Opioids can enhance both aspects of the pain experience. It has very potent analgesic effects without affection on consciousness. When patients treated with opioids, they are still aware of the presence of pain stimuli, but the sensation is not unpleasant. Because morphine can raise the pain threshold, also decrease the pain perception, and increase the pain tolerance. In the treatment of different type of pain, it also has different therapeutic result. For visceral and somatic pain, the effectiveness is better. But for neuropathic pain, it's relatively weak. In the treatment of dull constant pain, that effectiveness also is better than that of sharp, severe intermittent ones. So this is the first effect on CNS by morphine, analgesia. It also induces euphoria, sedation, and change in mood. Actually, after a dose of morphine, a typical patient in pain or an addict experiences a pleasant, floating sensation and freedom from anxiety and distress. This is euphoria. It also induces sedation. But for some normal subjects or other patients, they may experience dysphoria rather than pleasant effects after a dose of morphine. And because of sedation, drowsiness, and clouding of mentation are frequent concomitant of opioid action. After a dose of morphine, it is very easy to fall asleep. And ordinarily, the patients can be easily aroused from this sleep. It's different from benzodiazepines, similar to chlorpromazine. So do you remember that? Chlorpromazine, it also has a sedation for many people and also can induce sleep. However, the combination of morphine with other central depressant drugs, such as the sedative hypnotics, may result in very deep sleep. Next effect on CNS is respiratory depression. Usually, this respiratory depression is dose-related, and almost all of the opioid analgesics can produce significant respiratory depression. And this effect is related to the decreases the sensitivity of a brainstem respiratory center to carbon dioxide by morphine. Usually, many people after using morphine, especially in the treatment of pain, this effect on respiratory system, it has a tolerance. With the repeated use, this respiratory depression, it will become weaker and weaker. So it isn't, don't worry about this. But in some individuals with increased intracranial pressure, asthma, chronic obstructive pulmonary disease, this effect will decrease. This decrease in respiratory function may not be tolerated. So, for the patients with these problems, when they use morphine pimetamine, they have some problem in breath. Because of this respiratory depression, this is the most common cause of death in acute opioid overdoses. So, for the patients with intoxication of opioid agonists, try to recover normal of the breath. Next one, cough suppression. Suppression of the cough reflex is a well-recognized action of opioids. This suppression of cough, this center is in the medulla. The receptors involved in the antitussive action appear to be different from those involved in analgesia. And this cough suppression by opioid may allow accumulation of secretions. Cough is one important reflex to remove the secretions in the airway. So finally, it may be induce airway obstruction and even atelectasis. Do you understand this word? It means a situation of inadequate air in lungs. Codeine, it has been used to advantage in persons suffering from pathological cough, but now morphine, it also have this cough suppression, but because of more obvious addiction and dependence, they are not used to treat cough. But codeine, it is better because it has less addiction. Next effect on CNS is emesis. Because opioid analgesics also can activate the brainstem CTC to produce nausea and vomiting. I think you know. This effect just contributes to side reactions. But in the previous chapter, I mentioned apomorphine, In some drug medical research, maybe they are useful in, to make animal model of emesis to research antiemetic drugs. They are maybe useful. Yeah, this is emesis and vomit. Next effect on CNS is meiosis. Actually, contraction of the pupils is seen with almost all opioid agonists. And this result is related to the stimulation of mu and kappa receptors by morphine. And this meiosis is mediated by parasympathetic pathway. That's why it can be blocked by atropine, M receptor blockers. Because this meiosis effect has little tolerance. It is different from an analgesic effect on respiratory depression. It has very little tolerance. Even for some addicts, this still has this response to morphine meiosis. So that's why it is very valuable in the diagnosis of opioid overdose. So this meiosis is important diagnostically because many other causes of coma and respiratory depression produce dilation of the pupil. When the patient has intoxication of opioid analgesics, maybe because of respiratory depression, maybe the patients are in coma. But during that conditions, their eyes, pupil size is really small. But when the other drugs induce this intoxication, or even when the patients are in coma, usually their pupil size is relatively large. It's a big difference from intoxication caused by opioid analgesics. So this is very valuable in the diagnosis of opioid overdose. Because even in highly tolerant addicts, meiosis also will be seen. And this, also related to opioid receptor activation by opioid agonist. So this meiosis also can be blocked by opioid antagonist. These drugs also can change temperature set point, but it's different from chlorpromazine. Yeah, it can decrease this set point. And then at the beginning of using these drugs, body temperature maybe has a little decrease, but after a long therapy, maybe body temperature can increase a little. But this is not very obvious as different from chlorpromazine. Usually, it is not very important. And morphine also acts on hormone secretion. Maybe it can increase growth hormone release and enhances prolactin secretion. But this effect, it also is relatively weak. It's also different from chlorpromazine. So, just now, I introduced the pharmacological effects of morphine on CNS. It includes analgesia, euphoria, sedation and changes in mood, respiratory depression, cough suppression, emesis, meiosis, and changes temperature set point, and they have hormonal action. Yeah. So how about the principal effects of morphine? Let's go on. The peripheral effects of morphine. Morphine acts on the peripheral tissue. It also acts on smooth muscle and CVIs. There are a large area of smooth muscle in GI tract. So we first study GI tract effect. Morphine induces excitatory effects on smooth muscle. On GI tract, first the stomach. It can increase the resting tone of the stomach. So it may induce persistent contraction. So motility, caused by rhythmic contraction and relaxation, it can be reduced by morphine. It also can decrease the gastric secretion of hydrochloric acid. And on the small intestine, it also increases the resting tone of smooth muscle in small intestine and reduce amplitude of non-propulsive contractions. Act on the large intestine. Its resting tone also can be increased by morphine. So the propulsive peristaltic valves are diminished by morphine. You should understand this excitatory effect on smooth muscle is different from that caused by acetylcholine. I think in your mind you still remember the excitatory effects of acetylcholine on smooth muscle. It can promote the motility and propulsive peristaltic contractions of GI tract. But this morphine also has excitatory effect on smooth muscle, but because it mainly increases resting tone. So the rhythmic contraction under relaxation, because of resting smooth muscle tension, it can be decreased. Rhythmic contraction and relaxation of this smooth muscle can be reduced by morphine because of increased resting tone. Resting tone is increased, it seems the muscular tension increased. So the final result is opposite to that of acetylcholine. Maybe because it reduces the movement of the GI tract. So final result maybe lead to constipation. Actually, this effect on smooth muscle, it also has very little tolerance, almost have no tolerance on GI tract, this effect. So just because of this constipation, some patients with terminal cancer, actually for them, it is not necessary to consider addiction caused by opioid agonist. So, but some patients just cannot use morphine or other opioid agonists to control the pain, to relieve pain, just because of these adverse effects, constipation. But on the other hand, sometimes, like the patients with diarrhea, this drug can be used to control diarrhea. Of course, it is just one of symptomatic treatment. Once this diarrhea is caused by some bacterial infections, antibiotics are more important. Okay, the effects on smooth muscle. Biliary tract here, it also has smooth muscle. It also increases the biliary tract pressure. So the contraction of the gallbladder and the contraction of the biliary sphincter, they also increased. So it has a latency to induce biliary colic. So biliary colic, the patients, when they have this biliary colic at the local area, it also is very painful. And maybe some analgesics are necessary. But because of accessory effects on smooth muscle caused by opioids, so when you want to use these drugs, pay more attention to this result. Usually in the treatment of biliary colic, only use analgesics is not enough. Don't forget, usually also requires M receptor antagonist to make this smooth muscle relaxed from contraction. Remember, you have studied atropine and mentioned this. Act on the uterus smooth muscle. This drug also can prolong the second stage of labor by transiently decreasing the strength, duration, and the frequency of uterine contractions. So that's why, the pain of the labor is very, very hard. It's very hard to endure that pain. But morphine is forbidden in the labor analgesia. It is not useful because it can prolong the second stage of labor. It is relatively dangerous. Prolong the labor. Okay, these are the peripheral effects on the smooth muscle. And morphine also has effect on cardiovascular system. Actually, at the therapeutic dose, it has no significant direct effects on the heart rate and cardiac rhythm, but it may induce peripheral arterial and venous dilation, especially when morphine used at large dose. Maybe bradycardia and hypotension may occur. And especially for the patients with decreased blood volume, they are most susceptible to hypotension. So pay more attention to the patients with decreased blood volume. Because of respiratory depression, morphine can increase the pressure of carbon dioxide in plasma. So, if you have studied physiology, carbon dioxide, it is one factor to induce vasoconstriction in the brain tissue. So it can induce cerebral vasodilation, so increase the cerebral blood volume. Finally, it contributes to increased intracranial pressure. So some patients, some disease induce this increased intracranial pressure. It can induce brain tissue damage. So pay more attention to these conditions. For the patients with craniocerebral trauma, this disease is one contraindication for opioid analgesics. Craniocerebral trauma, it is one contraindication for morphine. Morphine, this drug also can stimulate histamine release from mast cells. So some patients after using morphine, maybe they show some urticaria and sweating and peripheral arteriolar and venous dilation. Yeah, this also contributes to hypotension caused by morphine. Because of histamine acting on the IV, it also has a latency to induce bronchial contraction. So for the patients with asthmatics, also you should give great caution. Okay, these are the peripheral effects on caused by morphine, has excitatory effect on smooth muscle and maybe induce bradycardia and tachycardia because of effects on cardiovascular system. And it also promotes histamine release. Yeah, okay. Based on the effects of morphine on CNS and peripheral tissue, what are the clinical uses of opioid analgesics? Try to guys. Next section I will introduce.